And now we are going across live to President Joe Biden's remarks on the White House's handling of Omicron. Take a listen in.
To get shots in arms with more places, more vaccinators, more times for folks to get vaccinated or get a booster shot. And we've added appointments for booster shots, adding hours, getting more convenient to get a booster every day. The second thing we're doing is more testing. Seeing how tough it was for some folks to get a test this weekend shows that we have more work to do, and we're doing it. First, let's talk about how we got here. When I took office we were 10 months into the pandemic, and even so, we had zero over-the-counter home tests in the United States, none. And if you wanted to get one, to get a test, you had to go to a clinic or a drugstore to have someone give you the test, and there were very few places to go. So we got to work. We quadrupled the number of pharmacies offering a free test, and there are now more than 20,000 places where you can get tested for free. At many locations, you can book an appointment online in advance to minimize your wait. We've worked with Google, so you can now search COVID test near me on Google to find a location. And now I know the lines have gotten very long in some states. That's why I ordered FEMA to set up pop-up sites in places with high demand to shorten the wait. We stood up 6 new sites in New York City in 5 days, and there are more coming. For over-the-counter at-home tests, as I said, there were none when we took office, none. Now we have 8 on the market, and just 3 days ago, another test was cleared. We went from no over-the-counter tests in January to 46 million in October, 100 million in November, and almost 200 million in December. But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. Because steps we have to take to increase the number of authorized tests, we're now able to purchase 500 million at-home rapid tests to be sent to the American people for free when they request it. And we're going to continue to use the Defense Production Act to produce as many tests as possible. And starting in 2 weeks, private insurance will reimburse you for the cost of at-home tests. We're providing access to free tests for folks who don't have insurance. But we have to do more. We have to do better, and we will. The third point I'd like to make is more support for your hospitals. On hospitalizations, let me start with this. Because we have had so many vaccinated and boosted, we're not seeing hospitalizations rise as sharply as we did in March of 2020, or even this past fall. America had made progress. Things are better. But we do know that with the rising cases, we still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff. That's why we stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We're mobilizing an additional 1,000 military doctors and nurses and medics to help staff hospitals. FEMA is deploying hundreds of ambulances and EMS crews to transport patients. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. We're ready to provide more hospital beds as well. The bottom line is we want to assure the American people that we're prepared. We know what it takes. And as this group of bipartisan governors has shown, we're going to get through it by working together. I want to thank the governors for their partnership, and I mean that sincerely. With that, I'm going to turn it back over to Jeff, and I understand you guys may have some questions. Jeff?
Good. I think we're going to clear the press first.
And now we're coming to you live where US President Joe Biden has been giving his comments on the current Omicron situation, COVID situation in the United States and what the government is doing in terms of its preparedness. And joining us live for more on this is our correspondent from New York, Susan Tehrani. Thanks for being with us on this broadcast, Susan. Now, we just heard President Joe Biden speaking there. Boosters and testing. He has said that these are the most important things to do right now. We know that Biden has been facing criticism for the slow rollout of these. He did acknowledge this in his comments.
He did acknowledge it. He also said, had we known sooner, we would have gone sooner with the testing. The Biden administration actually did know sooner. And this is not to point fingers. It's just to say that President Biden should have acted accordingly. First of all, in October, he was offered to buy 700 million over-the-counter testing kits, and he rejected. Back in August, he was also offered to buy more testing kits. Again, he rejected. And just again last month, the White House said that at-home test kits wouldn't be feasible. So they were warned. Now they're trying to take measures to eliminate what is happening right now. Perhaps better late than never. But we are seeing these cases rise. Testing might be the best option right now. More Americans are trying to get tested. We see a lot of long lines here in New York and elsewhere. 198,000 cases each day, and doctors are warning that we're moving towards 1 million cases each day. President Biden also said that hospitalizations are on the rise. We are seeing reports coming out that despite the fact that cases are on the rise, the hospitalization numbers aren't catching up to the cases. There are 5% hospitalization rates across the United States regarding COVID. So a discrepancy regarding that number as well coming from President Biden right now.
Right, Susan, on that, on hospitalizations, where he discussed this, he alluded to this being more predominant among the unvaccinated.
Yeah. Right. Again, this administration really focusing on vaccine and boosters. Doctors also saying that when you get vaccinated, the science shows that despite the fact that this is a variant that has no mercy to anyone, but vaccinated individuals are really facing less symptoms. They are not facing as severe symptoms as those who aren't vaccinated. More and more Americans are moving to get vaccinated, but again, more and more vaccinated individuals are also trying to get tested as well. So again, you know, the focus is really not only on being vaccinated, but now on being boosted. And we are getting reports here in New York that even trying to get those booster shots, those appointments are very hard to come by as well.
Absolutely. Susan, thank you very much for joining us for all the latest there.
WION, now available in your country. Download the app now. Get all the news on the move.